My name is Ross Hetherington. I'm a primary care manager in the NHS England team covering Humber and North Yorkshire. We found it really straightforward to get it set up with CQRS Local. It was easy to transfer our existing service specifications over to the system. We were really well supported to get the services offered out to our providers. We started out with 2 services and are considering expanding further. It's a really simple web-based platform, so easy to get users set up and for our team to manage our services and claims on a monthly basis. We had a really positive training and onboarding experience with CQRS Local, and especially the point of contact for our area, who was David O'Brien. He arranged a number of group sessions for our providers, which was really helpful in getting practice managers and practice staff engaged, and also offered individual training sessions to practices who needed it. We were supported as commissioners all the way through the onboarding process, and in particular, it was great to see that some of our feedback and development requests, which we identified while coming on board with the system, were taken forward, and we're now seeing those change requests go live to make our use of the system easier. So the key benefits we were looking for when implementing CQRS Local were reducing our time in the commissioning team spent logging claims. We work with over 100 practices and see over 100 claims per month, so that was a lot of time we were spending manually processing claims received by email. We wanted to see a reduction in payment errors associated with kind of human error, either in our providers or in our own team, and to give providers more clarity over when to expect payment and the status of the claims that they've made for our services. And we've really seen those come to fruition over the past few months. We're spending much less time logging claims that we receive by email, having moved everything over to the platform, and we're seeing far fewer errors and queries from providers about payment status, claims, and what they can expect to receive when. I always find the CQRS Local and National Help Desk to be very responsive. I usually email them and expect a response on the same day. I find the team there very knowledgeable and helpful, and they're usually able to either resolve my query or pass it on to someone who can help. We've certainly seen fewer inaccurate claims since we introduced CQRS Local. The system has 2 checks before approving a claim and much less chance of human error than the process we were using before. We would normally get several emails after each payment run querying the amounts, dates, and details around payments using the manual process. We now don't see that to anything like the same extent, so we're in the first few months of our first full financial year using CQRS Local, and we're spending far less time responding to queries from providers about payments. The scheme that we found most beneficial in using CQRS Local has been our minor surgery scheme. That involves a large number of practices across Humber and North Yorkshire, over 100, and we receive a large number of claims each month. So that's been responsible for the greatest time saving by moving that scheme to the payment platform. But we're keen to explore further options in the future, looking at the range of schemes commissioned across the ICB, and are hopeful that we'll be able to use CQRS Local to streamline those services as well. The thing I've been most impressed with is the responsiveness and support that we've received from the CQRS Local team. They've been very helpful all the way through the process, and have taken forward development requests to improve the platform that we've suggested. So it's been really great that the team have been as accessible as they have been.